Hello, my name is Jackson and this is my presentation on asthma. The human lung is an organ responsible for gas exchange. It enables oxygen to enter the bloodstream and carbon dioxide to exit. It's comprised of a network of airways starting with the trachea, which branches into the bronchi and bronchioles, ultimately leading to the alveoli. Surrounding the alveoli are the microscopic capillaries which facilitate gas exchange through thin, permeable membranes. The airway linings are covered with epithelium, which acts as a protective barrier against environmental irritants and pathogens while producing mucus to trap harmful particles. Immune activity in the lungs is carefully regulated, with cells like neutrophils and eosinophils only becoming active during infections or injuries to prevent unnecessary inflammation. The lungs are highly elastic, adapting to the rhythmic process of breathing, allowing for air to pass through easily and unobstructed, meeting the body's oxygen demands. Asthma is a chronic, incurable, and heterogeneous disease of the lung, characterized by sensitive lungs that become easily inflamed due to a variety of triggers. In a lung affected with asthma, the normal structure and function of the airways are disrupted by chronic inflammation. An asthmatic lung experiences swelling and irritation in the airways. This inflammation leads to narrowing of the bronchi and bronchioles, which restricts airflow and makes it harder for oxygen to reach the alveoli. Additionally, the airway linings produce extra mucus, further blocking the airways. The muscles surrounding the airways also tighten in response to triggers like allergens or irritants, a process known as bronchoconstriction. And this further limits airflow and makes breathing difficult. Additionally, immune cells like neutrophils and mast cells are often activated, and they release chemicals that increase inflammation. And all of these reactions greatly reduce the lung's ability to exchange gases, particularly during flare-ups. Unlike healthy lungs, which maintain a balance between defense and function, the asthmatic lung is hyperresponsive, which makes it harder for the body to get the oxygen it needs. On a deeper level, what is occurring in an asthmatic lung during a flare-up? Well, it depends on which type of asthma the patient has. There are two main types of asthma, allergic and non-allergic. Within these, there are more subtypes, but that's going to go beyond the scope of this presentation. Allergic asthma is driven by the adaptive immune system, which responds to specific environmental allergens like pollen, dust mites, or pet dander. When an allergen enters the airway, it triggers T helper cells to activate the production of IgE antibodies. These IgE antibodies bind to mast cells, which release pro-inflammatory mediators like histamine, leukotrienes, and prostaglandins. These mediators cause bronchoconstriction, increased mucus production, and airway inflammation. Non-allergic asthma is primarily driven by the innate immune system, which responds to irritants or pathogens. When an irritant enters the airway epithelial cells release danger signals, which are the cytokines, that attract inflammatory cells, including neutrophils and T cells. Neutrophils release pro-inflammatory mediators such as leukotrienes, and these are responsible for the bronchoconstriction, the swelling, and the mucus. Asthma affects various populations, with certain groups being at high risk due to a combination of genetic, environmental, and lifestyle factors. Children are particularly vulnerable as asthma is the most chronic condition in this age group. In Australia, around 10% of children suffer from asthma. While some children may experience symptom improvement or even resolution as they age, asthma can return later in life. Genetic factors play a significant role, with a family history of asthma or allergies increasing the risk of developing the condition. Racial and ethnic disparities also contribute to asthma prevalence, as Indigenous Australians experience higher asthma rates and worse asthma outcomes due to factors like socioeconomic disadvantage and environmental exposure. Smokers and those exposed to secondhand smoke are particularly at risk of developing both allergic and non-allergic asthma, with smoking exacerbating asthma symptoms and increasing the frequency of attacks. Asthma treatment varies depending on the type and severity of the condition. For most individuals, treatment involves the daily use of reliever and preventer inhalers, which contain corticosteroids to reduce airway inflammation and quickly ease symptoms. Severe or difficult to control asthma may require add-on treatments like long-acting bronchodilators, high doses of corticosteroids, or biologic therapies. Occupational asthma requires identifying and minimizing workplace triggers, while exercise-induced asthma is managed with pre-exercise medications. Regular checkups and personalized asthma action plans are crucial for managing the condition effectively. And that's the end of the presentation. Thanks for listening.